Hello, everybody. Welcome back to Page in America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker. Dr. Rob Davidson is traveling today. We got a quick show for you today. I'm going to give just a quick update on some healthcare news that's coming out of Washington, D.C. And then we're going to throw to an interview we taped yesterday with Dr. Kristin Lyerly on the legacy of Speaker Melissa Hortman. So stick around for that. But before we get into the interview, I did want to touch on just one piece of news out of DHS that we find pretty disturbing. It's been reported that RFK Jr.'s staff have given data on Medicaid recipients to U.S. Immigration and Customs Enforcement. That's commonly known as ICE. I'll read you just a little bit. President Donald Trump's administration this week provided deportation officials with personal data, including the immigration status on millions of Medicaid enrollees, a move that could make it easier to locate people as part of his sweeping immigration crackdown. An internal memo and emails obtained by the Associated Press show that Medicaid officials unsuccessfully sought to block the data transfer, citing legal and obvious ethical concerns. Nevertheless, two top advisors to Health Secretary Robert F. Kennedy Jr. ordered the data set handed over to the Department of Homeland Security, the emails show. Officials at the Centers for Medicare and Medicaid Services were given just 54 minutes on Tuesday to comply with the directive. The data set includes the information of people living in California, Illinois, Washington State, and Washington, D.C., all of which allow non-U.S. citizens to enroll in Medicaid programs and pay for their healthcare expenses. CMS transferred the information just as the Trump administration was ramping up its enforcement efforts in Southern California. Now, we're gonna talk more about this. We're hopefully going to be bringing in some folks to help explain sort of all the ramifications of this data transfer. But just on its face, you can see just how quickly this becomes a problem for people seeking care, and particularly targeting sort of blue states like California and Illinois that have expanded the social safety net. And here on this podcast, we believe everyone should have access to healthcare. There's not a situation I can think of where someone's basic human dignity and ability to access the healthcare system should be compromised. It's such a betrayal, and it also leads into an interesting conversation about states' rights. If states have chosen to do this, and they've chosen to do this with their taxpayer dollars, then the federal government is really having an incredible overreach by sort of rooting through the data sets and using it for purposes that have nothing to do with the delivery of healthcare, but have to do with customs and immigration enforcement. We're against it, we hate it, and we're going to talk more about it in the days to come. And with that, we're going to now go to what I thought was a good discussion on the legacy of Speaker Emerita Melissa Hortman in Minnesota. I'm here with our guest, Dr. Kristin Lyerly. Hi, Dr. Lyerly. How are you doing?
Hey, Miles. Thanks for inviting me.
Yeah, no, thank you for being here. We're here to talk about the legacy of Minnesota House Speaker Emerita Melissa Hortman and the accomplishments that she was able to achieve in Minnesota. I'm going to give just a little background. This is news that everyone has seen on television. But on June 14th, an assassin posing as a police officer entered the home of Minnesota House Speaker Melissa Hortman and shot her and her husband, Mark, to death. Minnesota Governor Tim Walz called the assassination an act of targeted political violence. The assassin had a list of targets that included abortion rights advocates and Planned Parenthood centers. In addition to the Hortmans, Minnesota State Senator John Hoffman and his wife Yvette were also shot in their home. Ms. Hoffman reportedly shielded their daughter from the attacker, and the daughter called local authorities who rushed into the scene and saved her parents' lives, both having survived the attack. Speaker Hortman had a long legacy of promoting healthcare causes. She was instrumental in passing the paid family medical leave legislation. She was instrumental in passing the PRO Act, which codified abortion rights in Minnesota. And she was a leader in the fight to create a Minnesota Care public option. And by all accounts, we would not have a prescription drug affordability board in Minnesota if it had not been for her leadership. Dr. Lyerly, I know you have been involved in the advocacy community, in addition to your practice, involved in the advocacy community in Minnesota and some of these very fights I just mentioned. Maybe you can share some of your reflections on Speaker Hortman's legacy.
It would be a pleasure because I had so much respect for Melissa Hortman and the work that she did. I only actually met her once, but I was involved in the teams of people who she pulled together to get this work done. And that was really the genius of Melissa Hortman. She knew that it wasn't about her. It wasn't about any specific political interaction. It was about pulling people together to achieve good for the people of Minnesota. And she focused on things like, Minnesota got better after Dobbs. The Dobbs decision happened. Most of the country got worse. I'm from Wisconsin. Wisconsin certainly got worse. Minnesota went on and passed the PRO Act. They codified abortion in their constitution. They made it easier and better for women to live in the state of Minnesota. And that wasn't it. They also passed protections for the LGBTQ community. They passed a shield law to ensure that people who came to Minnesota to practice medicine or to seek care would be protected. They wouldn't be able to be prosecuted by their home states or by other entities that wanted them to not get the care that they needed. She helped to pass educational reform, child care reform, responsible gun ownership, all of those things that progressives want to see because we know that they benefit the people. Melissa Hortman was at the center of all of it, pulling people together to make that legislation happen. We are so profoundly grateful to her here in Minnesota, where I am right now, but also across the country. Those of us who work in this space recognize the genius that she was, and we're all mourning together.
Absolutely. Yeah. As I was watching the news, one of my first reactions was how she was one of our best in terms of Democratic state legislators. You know, we at the Committee to Protect Healthcare, we work across the Midwest, we work across the Southwest. There's a lot of states where we work with legislators, and a lot of good legislators out there. There's a lot of bad legislators out there. And I actually never met her, but I pointed to her and her work as speaker in helping pass what they call the Minnesota Miracle, which was sort of getting through an extraordinary agenda in a small amount of time with a razor thin margin in the House and Senate. That her accomplishing the Minnesota Miracle was just pointed to her as one of the best Democrats out there. That the strategy and the discipline it takes and the compromise it takes to get so many incredible pieces of legislation across the finish line. When you're not working with like Democratic margins like in an Illinois or a California, I believe it was just 1-1 in the Senate and the House. That was such an incredible achievement. Yeah, we stand here grateful and in a different world because of her legacy.
And she took hard votes. You've probably seen, if you've been following this, an interview where she was talking about a vote that she had to take that she didn't want to take, that she didn't believe in, but she knew that she had to vote against something she believed in order to pass the budget in Minnesota. If they don't pass the budget, the government shuts down. So they had to get it across the line. It's a giant bill. It's got lots of components, and she had to take a hard vote in order to get it all done. And she was tearful and she was remorseful about it, but that's what leaders do. Leaders take lumps. Leaders step up in difficult circumstances. And I think her leadership transcends politics. We talk about her as a great Democrat, but as a physician leader, I look to her and think about some of the complicated situations that I've been in as a doctor and someone in leadership. There are so many things that we have to do that we don't want to do, that aren't easy and that don't feel good, but they're the right thing to do. And she did that every time.
Yeah, it's just that it's the list of accomplishments is such a testament to the skill too. Like that sometimes I think a lot of people sort of get angry at politicians or think poorly of politicians or even kind of make them something other than human. Sometimes when they talk about politicians, particularly in this case, but even your average person but they're incredibly human people, right? With flaws and we don't necessarily always think about a legislator having sort of a deep skill set in that arena of being someone who brings these incredible skills to bear to pass this legislation. It just strikes me how deeply competent and deeply accomplished she was. Being in the lower chamber of the Minnesota legislature, absolutely incredible. You know, there's been nonstop coverage of this on television, in the press. It's obviously, it shook the country. It continues to be something that's going to be discussed and talked about. It seems political violence is on the rise in the United States, and we hope the otherwise, but not going anywhere anytime soon. I was struck by how we weren't calling it terrorism. I went and I looked up the textbook definition of terrorism. I'm going to read it really quick. Terrorism is a calculated use of violence against civilians or other non-combatants in order to instill fear and achieve political, religious, or ideological goals. It's characterized by the deliberate targeting of civilians and the intent to create widespread fear and the pursuit of specific, often political objectives. And it struck me as we start to see the outlines of this assassin's life and sort of what he believed in, the church that he attended, that this was very clearly for political ends. I wonder why we are reluctant to call this what it is, which was political terrorism and a strain of a strain of right-wing political terrorism, and by most accounts.
I think we will. I think we'll get there. It's only been a few days. It was
Yeah.
Saturday, early Saturday morning, and we're taping, 5 days later.
Yeah.
There's a lot of information that still needs to be uncovered. One of the things that really strikes me, though, is how immediately we saw from the extremists on the right lots of messaging about how this person was a Democrat and they were appointed to a committee by Tim Walz, which is true, but it was a nonpartisan committee that's large, and he actually never met Tim Walz. It was not a political appointment. Then they also cited the vote that former Speaker Hortman took in order to get the budget bill passed. They took all of these little really precise pieces of information and tied it together and created this narrative that this was Democrats in the deep state killing one of their own who didn't agree. And it's wrong. It's just plain wrong, but it's so profoundly hurtful. And then to discover that there's this manifesto, which really wasn't like a well spelled out manifesto, but it was just a notebook full of names and targets. And to know that so many of my colleagues and friends, I'm an OB-GYN doctor and an abortion provider and outspoken in the advocacy space. And so many of my friends and colleagues are on that list, both here in Minnesota, but also there are 11 legislators in Wisconsin where I live who are on that list. We don't know. They've all been notified, but they're not talking about it, obviously, because we don't want copycat crimes to happen. But many of us don't know, are we in that sphere of some of those organizations that are potentially going to be targeted in the future? What does the future look like for us? It does create that fear and division and anxiety. Yesterday, I posted an op-ed on my Facebook page that was written by Minnesota medical providers about how this will not prevent us from moving forward and taking care of our patients. We provide healthcare, and abortion is healthcare. And we know that because we do this work. We have these conversations. We've done this training. And you wouldn't believe the comments that have come flooding in from all different perspectives. People saying, just be quiet, just stand down. We can't stand down. When we stand down, that means that people not only don't get abortion care, but then they don't get contraception. They don't get care for their complicated pregnancies. And in some cases, they don't even get care for their pregnancies and their miscarriages. So there's not a world in which we can just stop talking about it. We have to continue talking about it. We have to push through this fear created by this specific domestic terrorist and the sect that supports his work.
Yeah. Absolutely. You have conversations with your colleagues that are so much closer to this than, the folks who are either not on this list or don't work in the same field. Is there a fear that we're going back? There was an era of right-wing violence in the 90s, and the threats have never ceased, but there was sort of an era of like more threats against OB-GYNs and abortion providers and clinics. And it seems like we had a moment where that wasn't necessarily totally gone, but there was like a nadir of activity. Is there a fear that people are revving back up again, that there is that we're in an era of sort of backlash, or an era of a resurgence of right-wing violence or right-wing animus against abortion providers and people working in reproductive health?
Yes, but it's not just in reproductive health. We saw it with COVID. Remember what happened with healthcare providers in COVID who we stood up, we took chances with our own lives to save people. And because of this kind of political extremism, people were pushing back when we were taking care of their loved ones in the hospital, giving them the best possible medical care. People were demanding that we provide interventions that they were sold by a politician or by someone else who wasn't in the field, who didn't know how to treat their medical problems. So we have been experiencing more and more violence as healthcare providers really since COVID. In fact, as a healthcare provider, I am more likely to be injured on the job as a result of this kind of violence than my partner, who is a police officer. I'll say that again. Healthcare providers are more likely to be harmed because of violence than police officers. So yes, we are definitely seeing it. And as an OB-GYN doctor, especially an OB-GYN doctor who stands up for my patients when they are in the most vulnerable circumstances of their lifetimes, I think we are the most at risk.
Yeah, chilling stuff. It just seems, it's so senseless. Anyway, before we adjourn here, is there any sort of last thoughts on, I know we're talking about the assassin here, but for a moment, but back to Melissa Hortman's legacy. Any last thoughts on her achievements or sort of her life?
I think that if Melissa Hortman was watching us all right now, she would be honored at how we are recognizing her achievements. But most of all, she would want us to pick up the baton and keep moving forward. And if we failed to do that, we would be letting her down and we would be dishonoring all of that incredible work. So we've got to keep moving forward. We've got to keep taking care of each other. That's the core of this, is taking care of each other and making sure that we all can live our best lives. So I'm not deterred. I know my colleagues, we're taking a few moments, we're taking some deep breaths, but we're going to keep moving forward because that's what we have to do.
Okay. I think we can leave it there. Dr. Kristin Lyerly, OB-GYN and chair of the board of the Committee to Protect Healthcare. Thank you so much for joining us today.
Thank you, Miles.
All right, everyone. Thank you so much for joining us today. Thank you again to Dr. Kristin Lyerly. Thanks for the conversation. Today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. Produced by Amelia Dillenschneider, Aslan Ibrahim, and Joel Bryson. Music by Annette Somerset at Duneflower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, and wherever you listen. Your support helps others discover the podcast. Physicians, your voice matters in the healthcare fights that are happening now and will happen in the future. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. And we'd love your feedback as always. Please send your comments and suggestions to feedback@pageinamerica.org. We read everything that comes in. Thanks so much for listening, and we'll see you next time.